So I'm Dr. Robert Woodbury, and we're here to talk about the disease of obesity. So really, when we start thinking about obesity, what we're learning more and more is that it's a disease that has multiple factors. And the Healthy Steps program's evolved over the last 8 years to address the treatment of the disease as we know it. So some of the factors are genetic predisposition. So we know it's not a genetic disease, but there's absolutely a genetic component. And then there's also a physiologic component, and the derangement in hormones that goes along with the disease of obesity is actually tremendous. And especially in the disease of morbid obesity, some of the physiology is so deranged it doesn't even look close to normal. And then the other part is the environment, so things that we're putting in our mouth, thoughts, stress, nutrition, things in the lifestyle also absolutely affect the physiologic state of the body. And all this, when it's dysfunctional, it combines to give us the disease of obesity. And obesity is not just about weight, right? So it includes weight and pounds and too much fat, but also the problems with blood pressure and blood sugar and things like the metabolic syndrome and sleep apnea, all of which are taking an incredible toll on our society. So at Healthy Steps, we start by saying, all right, let's address lifestyle factors first. So we'll put those out of, on the baseline, we'll put those as a baseline treatment. So what does that mean? Nutrition. There are various good nutrition plans. Here we live in a Mediterranean climate, so we base our nutrition lifestyle on Mediterranean eating with some modifications that have to do with how much saturated fats we eat, and also the glycemic load of certain foods. So we alter that in the course of the treatment, and every patient gets a plan tailored to what they need. Secondly, exercise. So some patients know all about exercise and others don't. So we design an exercise program that's really individual. You know, what kind of resistance training can a patient actually do? Not just here's a plan and go to a gym and good luck. You know, what walking can you do? Can you do swimming? Can you do resistance bands? Do you like to do yoga? Do you like to do hiking? Whatever it is. But the exercise piece absolutely changes the physiology for the better. And stress, there's no doubt that stress is involved in obesity, and techniques for stress reduction absolutely can change blood sugars. And some of the patients will tell us that their blood sugars when they test it at home is absolutely elevated when they're under stress, with nothing else being different. So the lifestyle program really has evolved to handle that piece of it. And then the second thing in the program is medical therapy. So there are medications that help suppress appetite, but also there are medical foods that alter cell signaling that change the physiologic state in the body. So we use those as a medical treatment. And then for those people who suffer from morbid obesity, we add surgery to the treatment. And we do 2 versions of a gastric bypass, 2 sizes of sleeve gastrectomy, and 2 versions of adjustable gastric banding. So really 6 operations, and we try to match the exact operation that is needed in the patient's treatment plan, individually, extremely individualized. And so when we put all that together, you get the great outcomes that our patients tell you about at Healthy Steps Medical Center. I'm Dr. Robert Woodbury, and more later.